Hello everyone, welcome back to E.L.V.A Nursing YouTube channel. My name is Esther Philip-Oyedele and you can call me Esther Love, and I am going to be your nurse educator on this channel. The goal here is to simplify nursing content for you. I don't want to bore you with extra pizzazz, just to get straight to the point so you understand what you need to know, right? So this week, we're going to be starting endocrine system disorders. We already talked about diabetes mellitus, so you can check that out. But today we're going to be talking about acromegaly, gigantism, and dwarfism. Later this week, we'll talk about diabetes insipidus and SIDH, and we'll just continue in endocrine system for the next couple of weeks. So you want to definitely make sure that you are subscribed and your notification bell is turned on so you do not miss when another class drops. All right. So please make sure you share this with your friends at school, your colleagues, someone you know will need and benefit from this. And if there's any topic you want me to talk about, please let me know. You can drop it in the comment section, or you can shoot me an email at elvanursing@gmail.com and I will find time to talk about it. All right. So once again, please make sure you subscribe, like, share, and definitely comment. All right. Without further ado, let us dive right into today's class. So once again, my name is Esther Philip-Oyedele. You can call me Esther Love. We're going to be talking about acromegaly, gigantism, and dwarfism today. This is one of the endocrine disorders. So when we're talking about acromegaly, gigantism, and dwarfism, really the problem is in the pituitary gland. Where is the pituitary gland? It's in your brain. And it has two lobes like that. As you can see, that's divided into two. We're going to expand that a bit. And the first one in front is called the anterior pituitary gland. It's called anterior because the word anterior means front. And the one at the back is called the posterior pituitary gland. But the one we're going to be focusing on today is the anterior one. That's why I have it in red. And we're going to further break that down into the different types of hormones that it secretes. It secretes the thyroid stimulating hormone. It also secretes the adrenocorticotropic hormone, also known as ACTH. It also secretes your follicle stimulating hormone and the luteinizing hormone. And finally, the growth hormone, so your anterior pituitary gland. It secretes about 5 hormones. Now, the one we're really going to be dealing with today is the growth hormone, because that's the one that would cause acromegaly, gigantism, or dwarfism if something was wrong with it. Now, for our posterior pituitary gland, just for knowledge purpose, this is what secretes your antidiuretic hormone, also known as vasopressin. It also secretes your oxytocin. We're going to be talking about that in our next video. When we talk about diabetes insipidus and SIADH, that has to do with your antidiuretic hormone. So back to our focus for today, which is the growth hormone. We're just going to call it GH for short. But just so you know, it's also called somatropin. That's another name for it. Now, what does your growth hormone do? We're going to keep it simple. It's basically what it says it does. It's for growth. It's what regulates the rate of growth in your body. So let's break this down real quick. Remember, we said your anterior pituitary gland is what's responsible for the secretion of your growth hormone, which is also known as your somatropin. When it secretes too much, which is what we call hyperactivity, it's operating too much. It will either cause acromegaly or it will cause gigantism. And when it secretes too little, which is hypoactivity, it causes dwarfism. Now we're going to go ahead and do a quick overview. Once again, we have acromegaly, we have gigantism, and we have dwarfism. Acromegaly is the overproduction of your growth hormone after the onset of puberty. So when someone is done with puberty, they're in their 20s, they're an adult, and suddenly some of their features start getting bigger, that's not gigantism at that point. We'll call it acromegaly. However, gigantism is overproduction of growth hormone before the onset of puberty. So this child hasn't even started puberty, and they're already bigger than kids within their age range. They're getting taller and bigger and bigger. And of course, puberty comes, they get even bigger. So a very easy way to see it is gigantism occurs in children. while acromegaly is an overproduction of growth hormone in adults. All right, this person is already old. They're already grown. All right. And dwarfism is underproduction of growth hormone, which most time will manifest right from childhood. All right. So this is a quick overview of what we're talking about today. However, what we're going to do now is to take them individually and look over it again. So we're going to start with acromegaly. This is a woman here. This is what she looks like before acromegaly on the left, and on the right is what she's looking like with acromegaly. As you can see, her nose looks bigger, her lips look bigger, the entire facial structure is just bigger and more enlarged. So we've already defined it as an overproduction of somatropin, aka your growth hormone, after the onset of puberty. You might say, what will cause this to happen? Well, one of the biggest things that cause acromegaly to happen is mostly the benign tumor on the pituitary gland. Remember, your growth hormone is secreted by your anterior pituitary gland. So if there's a tumor at the pituitary gland, also known as an adenoma, it's going to be pushing on the anterior pituitary gland, and it's going to be making it secrete too much growth hormone. And then slowly you see this woman's facial structures start getting bigger. The very interesting thing with acromegaly is you really won't notice the change like that. Okay. In fact, family members don't notice the changes on time because they see this person every day. So they are not really picking up on the changes and difference in their outlook. If you're going to be assessing this, you might want to see pictures from maybe a couple years ago and now, and that's when you might be able to be like, oh, something definitely looks different here. The very sad thing about acromegaly is, unfortunately, growth changes that occur in acromegaly are irreversible, meaning that even when we probably take out this tumor, we're able to decrease the growth hormone. The big nose, the big lips, most of the physical changes are not really going to go away. And some of the internal changes too might remain. Now, let's talk about some clinical manifestations, which some of them I've already mentioned in this picture. So some of these patients start to have some visual disturbances. They have some headaches, their hands are larger, their feet are large, and it comes with joint pain. So one of the big things we want to take care of with this patient is that pain, all right? It really hurts. Their head gets bigger, their jaw gets more enlarged and protrudes. Their forehead is bulging. Their nose looks more bulbous, just looks more like bigger. Their lips also get thicker. Their tongue also gets bigger. So now that kind of affects their speech. So their speeches might not be as clear. And if the tongue is really big, it might even be causing some airway obstruction. All right. So that's definitely a big one we want to pay attention to. Their voice gets deeper. Their skin is oily, thick, leathery. It's just really rough. And another thing that happens is not just externally they're getting bigger, internally also some of their organs are getting bigger. The heart is getting bigger, the liver is getting bigger, the spleen is getting bigger. Well, you might say, is that really a bad thing? Yeah. Okay. Your organs have to be a certain size for them to work well. When they start getting bigger, that's not good. It, like for the heart, we're going to start having things like heart failure happen with this patient. Again, muscle weakness and joint pain. For the male, they might have impotence, and for the female, we might have some amenorrhea. Amenorrhea is they are not seeing their menstruation. That could happen. Now, how do we manage this? I want you to always remember, one of the best way to easily remember your endocrine system and how to treat them is, what is the problem here? Ask yourself that. So with acromegaly, the problem is we have too much growth hormone, all right? If something is too much and it's causing a problem, how do you think we're going to fix it? We're going to fix it by taking it away, by reducing it. Because if I reduce the too muchness, I can fix the problem. So with acromegaly, we are oftentimes going to treat with surgery. Remember, this most likely is caused by a tumor. So the doctor might choose to do surgery to take out the tumor. Most times when they're taking out the tumor, they also take out the anterior pituitary gland, unfortunately. And even sometimes the posterior pituitary gland. So they may end up taking out both of them. Now, remember, The anterior pituitary gland does not only secrete growth hormone, it also helps with your thyroid, it helps with your follicle stimulation. It has so many functions. So is your pituitary gland, helps with your ADH and your oxytocin. So if we take out all of that, the patient might have to be on lifelong hormones for life, replacing those other hormones that would have been secreted by those glands. All right. Now, if surgery does not work, the doctor might choose to do radiation. In fact, sometimes before they do surgery, they might use radiation to shrink the tumor a bit before they go into surgery to take it out. And in addition to that, we might do some drug therapy. So the medication octreotide is an anti-growth hormone. So growth hormone makes you grow. Octreotide inhibits it. It's an antagonist. It antagonizes the growth hormone production and hopefully reduces it. So that's how we would treat this medically. Now, as the nurse here, what are some things you want to pay attention to? Give this patient some pain medication for crying out loud, okay? Remember, they have some joint pains going on, so they're gonna need that. Swap diet and encourage this patient to express any feelings about their body image because they might definitely have some self-esteem issues that will go along with this because their body is changing externally and internally. And of course, if this patient goes for surgery, when they get back, you want to implement some post-procedure interventions like making sure the head of your bed is raised after surgery, you're checking for bleeding. And because this surgery has to do with the head area, anytime someone is doing a surgery that has to do with any parts of the head, the eye, the nose, the ears, when such person comes back from such surgery, you want to make sure they don't sneeze suddenly, they don't cough, they are not bearing down, doing Valsalva maneuver, bending over, all of those things. They can't do it because anytime a surgery is involved with the head or the eye, any structures ear and up, you want to not do such strenuous stuff because you could increase intracranial pressure, intraocular pressure, and so many things. The problem with acromegaly is that it also causes some big complications. One of that is hypoglycemia, also known as diabetes mellitus. So this patient is predisposed to that. They would definitely also be at risk for a lot of polyps in their colon. And when you have a lot of polyps in your colon, you are at a very big risk for colorectal cancer. So this patient needs to make sure they're on top of their colonoscopy screenings. Diabetes insipidus is another thing that can happen. Remember, the posterior pituitary gland secretes your ADH. When we take it out, let's say the patient goes for surgery and they take it out, now this patient's ADH level is decreased, which will cause diabetes insipidus. Hypertension, heart failure, cardiomyopathy because of the enlargement of the heart and so many other organs in the body. So these are some complications that the patient might have because of acromegaly. And we would have to then treat these issues individually outside of the disease process of acromegaly. Now, I really hope that was a good breakdown. Let's move on to gigantism. Now, the big difference between acromegaly and gigantism, once again, is that gigantism happens when you are younger. Acromegaly happens when you're older. Okay, it's also the overproduction of GH, but before puberty happens. So pretty much the child ends up growing into a giant size compared to their peers. This is also often caused by tumors, all right, GH, growth hormone secreting pituitary tumors. So this patient is producing way too much. Symptoms you will see in this patient is overgrowth of long bones. So their bones are longer than they should. They're abnormally tall. Their muscles are increased. Their weight increase because their body has to be proportionate to the height that they have now. And the fact is, even though they look bigger and taller than most kids, they might actually be weak because those bones are not that strong. They're just long. They're not very strong and dense like as they should. All right. So they might also get some joint pain every now and then. Now, how do we manage this? Again, when something is too much, overproduction of GH, we treat it by removing. Now, the very big thing that is good for gigantism is that let's catch it early so that we can nip it in the bud before this child grows really big. So early detection is huge. Quickly catch any possible gigantism situation going on. If they do catch it, the next thing we're going to do is again surgery to remove that tumor because there's a problem causing this tumor. So another thing is also radiation. So pretty much the same treatment plan for acromegaly is what we also have for gigantism. Nursing intervention, this is a child here, okay? Especially if we catch this much later. Now this child, especially for girls versus boys, they might even take advantage of the whole tall height stuff and going to basketball and stuff like that, like I'm big, you know. But for girls, it can be really big for them, you know, when you feel like you're bigger than other girls, that can cause some extra self-image issues. So this is something you want to pay attention to and potentially discuss and refer them to the appropriate personnel. You want to stress the importance of regular visits to the pediatrician and their endocrinologist to these parents so that we can stay on top of monitoring this child's growth and take appropriate measures so that we don't have any bad complications or issues. Some complications we can have, again, is similar to that of acromegaly. We can have hypertension, heart failure because the heart also gets bigger than normal, osteoporosis, like I was talking about earlier. Even though these bones are longer, they are not strong. They are not as dense. And osteoporosis is pretty much a porous bone, a bone that is not dense, that is not tightly packed, that is not strong. Usually this happens as you get older or you have a low calcium diet, but these patients might get it very early, whereby their bones are very dense and it's weak and it can break easily, it can fracture. So that's a complication we can have. The bones are thickened and they might also have some delayed sexual development as they grow. All right. I really hope that was good because finally we're going to be looking at dwarfism as we wrap up this class. So dwarfism is the opposite of gigantism, which is under secretion of GH. The child is going to look younger than they are supposed to look, all right, for their age. Some causes of dwarfism is tumors, also trauma, encephalitis, autoimmune issues, or a stroke. All right, there's so many reasons why that could happen. Clinical manifestation, obviously the child is going to have a short stature. They are going to have some dentition problem because, again, growth is not only in terms of size, it's in terms of everything developing the way it should. So the teeth development will be affected, their jaws are underdeveloped, delayed sexual development. They have obesity in their trunk area, in their midsection area. So that's what we call truncal. Sometimes it's also called central obesity. All right. Their muscle mass is decreased. They also have weakness. They're fatigued easily. And they're prone to having depression. And they also have a very flat affect. What's the flat affect? You say a very funny joke and they might just, they're blank. All right. You say something sad. Naturally, someone should probably have a very, oh my God, really? But they're not giving you anything. Their affect is just flat. All right. So that is something that we might have happening. And again, these are more like emotional and psychological symptoms. Now, for medical management, this is opposite of acromegaly and gigantism that we talked about. With acromegaly and gigantism, there was too much GH production. So what we do is to remove it. But with dwarfism, there is too little. When we don't have enough of something, the fix for that, the solution for that is to give more of it. So again, detecting this early is huge. And then since the problem is that you don't have enough GH, we're going to give you GH. All right. So somatropin injections can be given to this patient. It's kind of like a synthetic form of it. All right. Since you don't have enough hormones, we'll give you a synthetic form of it. So this can be given to the patient, and they might be lacking other hormones too that might need to be corrected to fix other deficiencies. And if it's a tumor that we're dealing with here that is causing this, then a surgery or radiation might be done to remove the tumor. Nursing intervention, encourage the patient to verbalize their feelings. Again, self-image, whether it's acromegaly, gigantism, or dwarfism, there is that self-image or distort body image, self-esteem that might be happening with these patients. So encourage them to talk about their feelings. For children, Encourage the child to wear age-appropriate clothes. Even though they have dwarfism, they might want to be wearing kids clothes. No, wear clothes that are appropriate for your age, not for your size or your stature. Also, the parents might want to be dressing them in those kind of clothes. So you want to encourage the parents to actually dress them appropriately. Let them engage in activities with your peers, appropriate activities, and also encourage and emphasize the child's abilities and skills and strength, and not just their physical size. All right. Complications for this patient is osteoporosis. So they would also have those very porous and less dense bone mass that can easily fracture, and some delayed sexual development. All right, so that is dwarfism. So once again, just to remind you of what we just talked about, acromegaly is an overproduction of growth hormone after the onset of puberty. Gigantism, an overproduction of GH before the onset of puberty. So acromegaly, adults, gigantism, children, and dwarfism is underproduction of GH, which mostly occurs while you're growing as a child. All right. So with acromegaly and gigantism, you have too much. We're gonna fix it by removing it. We can do surgery, radiation, or we can do the medication octreotide. For dwarfism, you have too little. We're gonna fix it by replacing it. So we're gonna give you somatropin, or we can do surgery to remove whatever tumor might be causing this. All right. All right, everyone. I really hope that today's class was beneficial to you and you learned a thing or two. Once again, make sure if you are not subscribed, please subscribe. Please, 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 please. And share this channel with some of your friends and colleagues, a family member you know needs it. Let them know, like, comment, and if there are any topics, any nursing content or problem area, please let me know. You can drop it in the comment section, or you can shoot me an email at elvanursing@gmail.com, and I will definitely attend to it. Thank you so much. I'll see you on the next one. God bless you.